6 new confirmed cases and 14 probable cases. There are no further deaths to report. We now have 728 reported cases of people who have recovered from. That's an increase of 100 on yesterday. And the new combined total of confirmed and probable cases in New Zealand, Aotearoa, is 1,386. Today there are 13 people in hospital, and this includes 3 in ICU, 1 each in Middlemore, Dunedin and North Shore hospitals. 2 of these folk in North Shore and Dunedin are in a critical condition. Yesterday there were 2,100 COVID-19 tests processed, with a rolling 7-day average now of 2,761, and the total number of tests completed is 66,499. I spoke last evening with District Health Board CEOs about the message I had conveyed to them around the need for us to increase testing following the Easter break. They're all very aware of this and are actively working with their teams to increase testing, including the use of mobile testing in some places to reach specific communities and groups. There are now 16 significant COVID-19 clusters. That's 1 more than yesterday. The new cluster is in Auckland and again is connected to an aged residential care facility. A reminder that a significant cluster is where there are 10 or more cases of COVID-19 that are connected. We'll provide more details on that and other clusters on our website. I just also want to point out, when you see our update on clusters, you will notice there has been an increase in the number of cases associated with clusters, actually a higher number than the total number of new cases today. And this is because cases that were previously identified as not knowing what the origin was have now been associated with those clusters, and therefore that is reducing the number of cases for which we don't know where they have come from, and this is good. Also, just the 15th cluster we talked about yesterday, which is also linked to an aged residential care facility. That was named yesterday by that facility itself, St Margaret Rest Home in Te Atatū in Auckland. That facility is working very closely with the DHB to contain the spread, as our other aged residential care facilities do. It's not an outbreak that is confined to that facility. It has some people inside the facility and some in the community. I want to briefly update some further analysis I commissioned around healthcare workers who have been infected with COVID-19. We will update the figures on our website today, and the total number is 115, which is 8% of total confirmed and probable cases. What I can say from that analysis is that there are only a small number, less than 5, where we can confirm that the cause of the infection was that the worker was infected by the patient they were caring for. So, for example, 22% of the healthcare worker cases because of overseas travel. They had in fact been overseas recently. Furthermore, from yesterday's total, which was 107, I wanted to know how many had been infected outside the workplace, and that was because they might have travelled overseas or they were part of a community-based cluster. And the answer to that was 56. So over half of those healthcare workers have actually been infected because of travel or are a close contact of a case outside the workplace or part of a cluster outside of the workplace. I wanted to know how many had been infected in the course of their work, and the total there was 46. And 39 of those are in aged residential care facilities and are part of the extant clusters we have there. In just 5 instances, it was not immediately clear and hasn't been worked out where the infection has come from. I think what all this means is, pleasingly, there is only a relatively small number of cases involving healthcare workers that are due to transmission from a patient or a resident, in the case of ARC, to the worker. And in the majority of those transmissions or clusters inside healthcare settings, more staff have been infected than patients. So I'm requesting ongoing reporting and breakdowns of this data, and I think what it does show overall that there's been a huge amount of work across the system to ensure staff are protected. That includes access to and appropriate use of PPE and very good infection prevention control, and I want to commend the efforts of all those involved. That's all I have. Over to you, there, Prime Minister.
Thank you, Dr. Bloomfield. Today, I can confirm that myself, government ministers and public service chief executives will take a 20% pay cut for the next 6 months, as we acknowledge New Zealanders who are reliant on wage subsidies, taking pay cuts and losing their jobs as a result of COVID-19's global pandemic. We feel acutely the struggle that many New Zealanders are facing, and so too do the people that I work with on a daily basis. And while it in itself won't shift the government's overall fiscal position, it is about leadership. And I acknowledge my colleagues, both in the executive, but also the colleagues we work with in the public service for the decision that was taken today. But it also stands alongside many actions taken by many people, private sector, citizens, to tackle the health and economic challenges of COVID-19, including the more than $23 billion economic package, including the wage subsidy, which has paid out over $9 billion to 1.5 million New Zealanders, which MSD have worked tirelessly to make sure was reaching the people who needed it the most. Neighbours looking out for one another, rent freezers and landlords who are supporting tenants, things like the winter energy payment and benefits that are helping those who are on restricted incomes to keep warmer and well, New Zealanders who are staying home to save lives, the student army delivering groceries to over 65s, and Ministry of Health officials in charge of mandatory quarantine, for which I've received a message about their professionalism and exceptional work. So many examples of people showing what others mean to them and doing their bit in our united fight to stamp out COVID-19 and showing a little bit of kindness along the way. If there were ever a time to close the gap between groups of people across New Zealand in different positions, it is now. Of course, many people in our public sector are our frontline essential workers, nurses, police, healthcare professionals. We are not suggesting pay cuts here, and nor would New Zealanders find that appropriate. Rather, I am responsible for the executive branch, myself and ministers. This is where we can take action, and that is why we have.